So for the diagnosis of orthopedic impairment, at some points you can see it when they're born or when they're really young, when they're toddlers, but because the definition, according to the IDEA, shows how education is affected, sometimes the diagnosis process doesn't really start until they're of school age. And so the AASEP, which is an association for special education professionals, they actually did a list of processes that go into the diagnosis of orthopedic impairment. So the first would be a medical statement by like a doctor or health professional that says they have an orthopedic or neuromotor impairment, and it kind of gives a description, shows medicine tests that they've done, or if it's a motor impairment, they describe it. And then it goes to a motor assessment, which shows how well or not well they use their fine motor, gross motor, and self-help when it is inappropriate. So they have different qualifications for different parts of the body, different impairments. So depending on whether they have cerebral palsy or bone tuberculosis or spina bifida, it may be a little different, but most of them are pretty similar. And then the next step would be assessment to determine the impact of this disability. So whether it's severe, if it is moderate. So it shows the effect on the educational performance. That's usually more standardized tests, and it goes for kindergarten through age 21, or it's on the developmental progress if it's a younger student. So when they're 3 through the age of eligibility for kindergarten. So if this is a disability that is detected early on, then they would use that option. But if it's more later in life, when they're more like when they start kindergarten, then they would use the first option. But both of them are more standardized tests to see how they're developing, whether they're developing okay, and how their education is doing with their disability. And then the last one would just be any additional evaluations or assessments. The adaptive skills is one that's a part of it, because that is part of disability identification. So they do have to do like an adaptive skills. It's a little modified for orthopedic impairment, but they do have like an adaptive skills. They take their test scores, their achievements, they take statements from their teachers, from their parents, from any other professionals that they've had, and that is all collected to identify whether or not they have an impairment, what the impairment is, and how severe it is to the student.